Hi, I'm Dr. Shalini Malhotra. I'm a dermatologist and a hair transplant surgeon practicing in Delhi and Gurgaon. Today I would like to talk about the technique which we use for our hair transplant surgeries. So you all must have heard of the FUE technique. FUE stands for Follicular Unit Excision technique. Now this is a very standard procedure performed in about 90% of clinics in India and globally. In this technique, what happens is that the back of the head, this part of the head, which is known as the donor area, this area is trimmed and hair follicles are extracted one by one. Extracted as in there is an instrument known as a punch. So hair follicles or grafts are pulled out from the back of the head using instrument which is known as the punch and then implanted one by one over the bald area, which is generally in the front or at the crown, using forceps. Now what do I mean by the forcep technique? Well, in the forcep technique of implantation, which is done in the FUE procedure, in the bald area first holes are created or slits are created using needles or blades. Now these holes or slits are then filled with grafts using forceps. Now when the grafts are put in these slits or forceps, technicians do this procedure. It's a technician dependent procedure. Doctor basically just makes the slits or the holes on the scalp and either stays in the OT or goes out of the OT. That's a doctor's prerogative decision. But the implantation is mostly done by the technicians. Now, what happens in this procedure? Logically, till the time the hole or the slit, till the time it is filled with the graft, it will bleed because it's an open hole. So there is a lot of bleeding in this procedure till the time the hole is filled with the graft. That's the first thing. Number second, now since mostly technicians do this procedure, the acumen of a doctor or a surgeon is lacking here, because a technician, no matter how competent and experienced he may be, a doctor's acumen and the knowledge will not be compensated in any manner when a technician is doing the procedure. Number third, when the graft is put in the hole, the depth sometimes is not guarded. So what happens is the graft can either be implanted too deep or sometimes it is too shallow. So that can lead to some skin changes when the final growth happens. And fourthly, the direction may not be that perfect as of the existing hair or the original hairs, because it's like putting a seed in a flower pot. So when in a flower pot a seed is put, the plant when it grows can take any direction. Similarly, in a hole, when a graft is put with the help of the forceps, when the graft grows, the graft sometimes may not follow the natural direction of the hair follicles. It may go haywire. What we do is an advanced form of this conventional FUE procedure. In this procedure, we do not create any slit or holes. What we do is that we have a pen-like instrument. Suppose this is my instrument. This is known as the implanter. So I will take this instrument, extract the graft from the back, load it at the tip of the instrument, take it near the scalp and just give it a push, and it will go inside in one step without creating any reception hole or slits on the intact skin. Now logically, when there is no hole or slit created on the intact skin, there is no bleeding. As soon as the graft is implanted in the intact skin, it creates its own passage and immediately plugs that passage. So as a result, there is very less bleeding or minimal oozing in this procedure compared to the conventional FUE procedure. Number second, it is a surgeon dependent procedure. Abhi tak, till now, technicians have not dominated this field. Only doctors do this implantation. So in my clinic, the implantation is completely done by me, not by the technicians. Each and every graft is implanted by me or my fellow doctor or my fellow colleague, but not by unqualified staff or by technicians or nurses. The hairline is also created by me. In our technique, the hairline is very natural. The result is very dense. It is so natural that till the time you don't go and tell people that you have undergone a hair transplant done, no one will be able to make out. They will think that it is your own natural God-given hair. Thirdly, the direction of the hair follicle and the depth of the hair follicle, it is all guarded because of this instrument. This instrument at the tip has a guard which can be adjusted according to the length of the hair follicle. So hair follicle is placed exactly at the same depth where the original hair follicle before baldness happened. Before that, whatever depth the hair follicle was at, we will also be placing the new follicles at the same depth. The direction is also very natural because this instrument named Implanter is a very sleek instrument. It is very easy to give very acute directions. So for instance, the hairline has falling hair, I will be able to give you exactly the same direction with this instrument known as the implanter. Overall, our technique is technologically more advanced, it is latest, recovery time is very fast, there is minimal bleeding, fast recovery, overall compliance is good, and overall experience as described by the patient is delightful. In one word, I would say it's a delightful experience. So do visit our clinic and have a consultation with me one-on-one so that I can explain this procedure to you in a better manner. I will show you some videos, I will show you some results to actually back up what I am talking right now. So you will actually see the proofs and not just plain talking here. So in case you are interested, my number is given below. You can contact me or you can Google my clinic's address and you can visit me whenever you want. Thank you so much.